Welcome to Adapt NCLEX. If you're watching this video, you're officially an Adapt NCLEX family member. This test is going to tell you exactly where you stand. 85 question, English practice question, English review question, covering everything, like a mock simulation, exactly what you're going to see on the NCLEX. Grab your pen and paper, keep track of your score, achieve 65, and your way passing. Buckle up, let's go. First question, as you can see, what do you see? Maternity. Each question, I will tell you where it's coming from as much as possible I can, but you should be able to recognize what kind of question and what kind of category I'm being tested. Which cause of postpartum hemorrhage should the nurse suspect? A nurse notes continued heavy vaginal bleeding despite a firm uterus, uterine atony, retained placenta fragment, bladder distension, uterine inversion. Stop the video, pause it, pick your answer, follow the buzzword, and then you'll be right. You get your answer? This is the way you should approach the question. Use the buzzword, read the question from the back. Which cause of postpartum hemorrhage? That means all of these can do that. Should the nurse suspect about what? Patient is still bleeding, continuous heavy bleeding despite firm uterus. So the uterus has to be firm. It has to be contracted. Which condition would do that? It has to be retained fragment. Why? What is the problem? Placenta fragment will prevent the uterus to be completely contracted. At the same time, it will cause what? Bleeding because of retained fragment. Look at the other answers. For a firm uterus, uterine atony is gone. For a firm uterus, bladder distension is not associated with that. When the bladder is distended, the uterus cannot be firm. Uterine inversion, you're going to have placenta already out, and that is what is going to cause the bleeding. The uterus will not be firm and contracted. That's the condition that you should be familiar with. Therefore, retained fragment is the best answer choice. That's what we got. And the persistent bleeding, despite firm uterus, think of a fragment, placenta fragment in the uterus. A client taking Theophylline is prescribed what? Which new medication the nurse should question? It's a risk reduction, but mostly pharmacology. You have to know what is Theophylline and what medication you should avoid. That is all the question is asking you and break down for you. Now look at the answer. Ciprofloxacin, albuterol, caffeine tabs, cimetidine, and metoprolol. Select or apply. Don't overselect. Pick those that you're 100% confident. Pause the video. Pick your answer. You pick your answer? I can tell you the key concept, and like I said, every question you got it. Question the information. Theophylline. This is what? Using asthma, right? It's using asthma. It's a long acting. What are the things you should avoid? I call it the 4 C's. Cirrhosis. Anything that affects your liver, you should worry about it. Cimetidine, ciprofloxacin, and what? Alcohol related affecting your liver. Or caffeine is another last one. So these are the C's you should worry about when you're taking Theophylline. Do I see C? Ciprofloxacin. I see another C, caffeine tabs. I see cimetidine, metoprolol inhibits the effect of Theophylline. So that's why that would be the answer. Albuterol is not a problem. These are concepts. I want you to write them down. Pharmacology. If you don't know, at least I want you to know the 4 C's. Ciprofloxacin, caffeine tabs, cimetidine, and cirrhosis affect the activity of Theophylline, leading to toxicity. And this is caring for a client in telemetry unit. The cardiac monitor displayed the following rhythm. Which action should the nurse prioritize? Initiate synchronized cardioversion, start high quality chest compression, review client medication list, administer what? Atropine. What do you think? This is what you are. You're taking the NCLEX and you see this. Will you run away from it? And hope so. You shouldn't do that. EKG questions are all concept. They don't want to trap you. If you figure out what he's asking, you'll be able to do that. Can you recognize it? And what do you think? If based on this EKG, what are you going to do? Synchronized cardioversion, high quality CPR, review client medication list, and atropine. Pick your answer? I hope you did. Now, look at it. This looks like ventricular rhythm. I don't see atrial rhythm. And I see some meandering. I go down this different shape compared to that. It's a smaller one. This is a bigger one. This is what we call Torsade pontes. Due to low magnesium, it leads to QT prolongation. Therefore, you don't need to do synchronized cardioversion or CPR. You got to make sure medication related. Any medication that causes QT prolongation or low magnesium is your answer choice. And that's the one we're going to pick. How did you do? Was that difficult? And no, not because you watch adapting class and you can figure it out. And it is reviewing the dietary tray for a client receiving what? Linezolid. Which item should the nurse report to the care provider? Is pharmacology, a little bit of risk reduction. Therefore, patients taking Linezolid, what food item should they avoid? This is application, mental health, right? Pharmacology. Grilled chicken with steamed broccoli, turkey sandwich with apple slice, pepperoni pizza with a glass of red wine, baked salmon with the brown rice and the green beans. To be able to answer this question, you have to know Linezolid. Like I said, keep track of your score and achieve 65 over. You pick your answer? I know you pick it. If I'm answering this question, I go back to the question and figure out what is the bias rate. Report to the care provider. You know this risk reduction question, very important part of the NCLEX category. And next is what? Reviewing a client dietary for what? Linezolid. I've asked myself, why did they give me diet and Linezolid? That means there's something related to Linezolid you should care about. Write it down. This look like MAOI. It has MAOI features like antidepressant, or phenoxin, those guys, Sertraline. It look like it acts like them. And what is the major problem? They should avoid Tyramine food because it leads to hypertensive agency. Which of these is Tyramine food? That's all. Break down the question. You can see pepperoni, avoid it. Red wine. The rest of all, chicken, broccoli, sandwich, baked salmon with the brown rice and what? Green beans. The alleged active in content in terms of tyramine compared to pepperoni cheese and red wine. Those are bad. Patient should stop eating and they should be reported to the provider. So MAOI-like symptoms. A client taking Sertraline is prescribed what? Which new prescription medication the nurse should question? The same idea. This is pharmacology with a touch of risk reduction. Selected apply. Selenium, Tramadol, St. John's wort, Metformin, Sumatriptan. Stop the video, pick your answer, keep track of your score because we're aiming over 65. You pick your answer? The way to approach the question, go back, Sertraline, identify it, it's an SSRI. I need to question anything that has serotonin in it, I should avoid it. MOI, you should avoid it. Yes, serotonin, norepinephrine, and dopamine, bad problem. Tramadol is opioid that has serotonin agonist. St. John's wort, same thing, serotonin. Metformin does not have serotonin, but Sumatriptan is a serotonin antagonist. This is what we use for migraine. Therefore, pay attention to that. So, triptans are very good, high level of serotonin. You cannot combine it with SSRI, otherwise they will be in trouble. And this is assessing a 12-hour-old newborn. This is a newborn, health promotion question. Delivering at 38 weeks to opioid-dependent mother. Which assessment finding the nurse should expect in the newborn? There's a keyword. If you ignore it, it will be difficult to find the right answer. Irritability, high-pitched cry, very sleepy, hungry and cycling vigorously. What is your right answer? Once again, if you're watching this, you're adapting class member, thank you for doing that and welcome. And if you're watching it, I want you to put down where you're watching it from. And number 6, tell me which answer choice you pick. I'll give you 5. You pick your answer? To be able to answer this question effectively, Go back to the buzzword. There's one word there. If you don't pay attention to it, you will change the answer. 12-hour newborn, so less than 24 hours. The parents were using opioid. The key is if they are less than 24 hours and mommy was using any drug, opioid, they're going to be what? Intoxicated with it. If it's alcohol, the baby is intoxicated with it. If it's opioid, baby will be intoxicated as if baby has opioid. So you see symptoms of what? Opioid intake, not withdrawal. Irritability is withdrawal. High pitch cry is withdrawal because it's a downer, everything goes up. Very sleepy, intoxication, and very angry and cycling is withdrawal. So baby will withdraw after 24 hours, but for right now, baby is going to be dependent with a opioid, and therefore that's the right answer. Number 6 is what we're going to pick. This is the way you should approach every question. Break it down, figure out what is being asked, and when you figure out, you can see that it's not that tricky. You just want to know what you're thinking. And this is receiving report for a client who has diagnosis of schizophrenia. Which of the following findings or interventions should the nurse expect? Select other plan. If you have schizophrenia, what should I expect and what do I do if I'm admitting you? Disorganized thought process, auditory hallucination, flagged affect, participation in what? Group therapy during acute psychosis, initiate of physical restraint as needed, delusion, and prescription for fluphenazine. If you're taking care of this patient, what do you think the provider will order? And all these, yes or no? Pause, find your answer, keep track of your record. I can tell you right there, there are certain things you need to know about schizophrenia. They have what? Disorganized thought process. They're going to have hallucination. They're going to have some form of delusion. Because he has positive and negative symptoms, they're going to have flat affect. Participation in a group therapy during acute psychosis, no, they don't need group therapy. You are the one, they're going to have one-on-one therapy. Initiate a physical restraint as needed, never restrain this patient. Prescription of fluphenazine, this is a first-generation antipsychotic, they may get it in acute psychosis. This is what your graph will look like. And this is the content associated with the positive and negative symptoms and the treatment. This is a rhythm. Pay attention to that. Don't worry. This is maternity question, labor and delivery. And this is caring for a client receiving Pitocin, oxytocin, and observes the fetal heart monitoring strip below. What is the next priority? Stop the Pitocin, place the client knee to chest position, place the client in lateral position, notify the air care provider. And this is your rhythm. What do you see? Are you worried about it? Is this abnormal or normal? Tell me what you want to do. Patient is getting Pitocin. Which answer choice are you going to pick? You stop the video, select your answer. But I can tell you, when you're receiving what? Pitocin, how many contractions are you worried about? More than 5. 1, 2, 3, 4, 5, 6. When they give you a strip, the top one belongs to the baby and the lower one, mommy. The mother should not have more than 5 contractions because it's 6 contraction. That means mommy is contracting too much. Tachysystole, that is what is making the baby not happy. Therefore, the first thing is to stop the poison before you do something. Positional, then IV fluid, oxygen, notify the air care provider. Your slide on. That's the key. And this is caring for multiple pediatric clients on the medical unit. Which client should the nurse prioritize? This is prioritization question. Even though it's a PEDS, this is prioritization now. What do you think? 6-month-old infant with ventricular septal defect who has what? Loud murmur and mild diaphoresis during feeding. A 2-year-old child with tetralogy of Foley who is squatting after playing. A 4-year-old child with the history of heart failure who has what? Sudden irritability, tachycardia, and diaphoresis. A 5-year-old child with rheumatic fever who has joint pain and low-grade fever. Pause the video, use the B-sharp, look at which one is the key. But make sure you figure out what is wrong with the patient. Remember, the B-sharp is not ordered. That's just because you start with the B, That's your priority. No, look at the situation. Worry about things that you should worry about. Pick the right answer. You post the video, get your answer. Are you ready? I can tell you the right answer is C. Why? Think about it. The child has heart failure, all of a sudden the irritable tachycardia and diaphoresis. That means what? This is exacerbation, heart failure. 2 years with tetralogy of Foley. Fine. And what is he doing? Squatting. Squatting is good for them. It decreases what? Shunting. 6 months old, ventricular septal defect. That means it's a left to right shunt. I expect mama. I expect diaphoresis when they feed. Don't worry about it. A 5-year-old rheumatic fever, your joint is going to hurt. You're going to have fever. That's all expected finding. This is how you do prioritization. Go for the keywords so that you don't get distracted. Now, this is fundamentals. Want to learn something. Place the following steps in the correct order of what? Performance, skills question. And this is preparing to irrigate the ear of a 50-year-old. Is an adult. What do you do? Position inhaler to affected side, dry the ears, at warm solution, pull the auricle up and back, irrigate towards the side of the ear canal and basin over the affected ear. What do you think? Stop, arrange, and pay attention to the keywords, all the conditions you need, 50-year-old, and then which steps you should take. I can tell you, the first thing is you get your solution. Make sure it's warm. Then you position the client. The head has to be tilted towards the affected side. Then place the basin under that because that's where you're going to wash it. And then pull the ear because it's an adult, you go up and back. Then you do the irrigation and cleaning up. That's all. This is the way it's supposed to be. That's the concept associated with it. Pay attention and then know it. And this is providing teaching to a client with rheumatoid arthritis. What do you know? Always be ready to be compared to osteoarthritis. Which instruction should the nurse include to relieve joint stiffness? That's the thing. I need to relieve joint stiffness. So that's what the question is asking you. Focus on joint stiffness. I always will give you buzzword because if you focus on rheumatoid, you're not helping yourself. Joint stiffness. That's what the question is asking. Take a warm shower or bath in the morning. Sleep on the firm mattress. Perform high impact exercise daily. Apply ice packs to the affected joint. What do you think? Once again, stiff joints. I can tell you the right answer is A. Why? When a joint is stiff, we want more blood to go there. What increases blood flow is heat. Therefore, warm is much better. If you put firm mattress, that is the treatment of preventing stiffness for rheumatoid arthritis. In the evening when they're sleeping, hard mattress to keep the joint straight. It does not answer the question. Patient already have stiffness. To relieve it, we need heat. A lot of people will pick B, anklet strap. Write it down. Answer the question is asking you, and that means stiffness is warm. Therefore, cold is a wrong answer. Doing high impact exercise will make it worse. This is the way you answer question. You answer what you're being asked to do. Another prioritization. How do I know? First, so this is management of care question. A client with grave disease will report what? Heat intolerance and weight loss. A client with what? Addison disease who has a mean arterial pressure of 45. A client with type 2 diabetes who has a blood pressure of 240. A client with what? Hypothyroidism who report fatigue and cold intolerance. What do you think? And nurse is caring for multiple clients in the medical surgical unit, right? Which one would I see first? Pause, answer your question based on your buzzword in the bishop. But I can tell you, this Addison patient with the map of 45 is in trouble. That is shock, hypotension. I'm worried about it. Grave disease, you're supposed to have heat intolerance and weight loss, expected. Type 2 diabetes with your glucose 240, well, you're not dying from it. They don't tell me this patient is having DKA or HHS. Hypothyroidism, everything is down. Fatigue, cold intolerance, expected finding. Next generation NCLEX. Are you ready? Let's get to it. Read the question. Make sure you know the first two words. Find the diagnosis. After you find a diagnosis, the rest of the question is easy. This is a bow tie question. Bow ties NCLEX case study. A 62-year-old presents with what? Acute confusion. Why are you confused? You have fever and chills. Those three things bad. Fever, chills, confusion. Combination is a bad problem. I want to know why you confused, why you have fever, and why you have chills. Patient has history of type 2 diabetes, hypertension. It does not help me. On physical exams, blood pressure is 85/60, hypertension. So you have all these things in addition to hypertension, something is wrong. The tachycardia, hypertension, tachycardia, combination, you should be able to make the diagnosis here. Look at the last word. The skin is warm and flushed. Which situation? You have hypotension, tachycardia, and your skin is not cold and clammy, it's warm and flushed. That's the bad word. And I see white count of 18,000, infection, lactate, I'm dry. You know the diagnosis. What do you think the patient is suffering from? Which condition the client is suffering from? This is what they've given you. It cannot be hypoglycemia alone. They have fever. They have signs or symptoms of shock. This patient has septic shock. It cannot be acute meningitis. Even though I have confusion, there's no evidence. I will give you some infectious problem on physical exams. I will tell you the abnormal rigidity and all those things. There's nothing like that. And HHS, I have to give you more information. Just because they're glucose and confused, they don't have fever. And the warm skin changes everything. Therefore, this is septic shock. If there's a septic shock, what are you going to do? First, you find the diagnosis, then you go for action. What am I going to do? Well, you need some fluid, IV fluid, antibiotic, and then what? Prepare for lumbar puncture. That is for what? Meningitis. Start insulin infusion. That's what? HHS. Therefore, I'm going to initiate vasopressin. Therefore, A and D. If I do that, what am I going to do? I'm going to monitor those things. Your blood pressure, because your blood pressure is low, and your urine output, I'm going to monitor them. I'm not going to worry about your blood glucose or your WBC. It's not going to help me. It's going down. But I want to make sure a shock patient, they have good perfusion. That means their blood pressure and their urine output. Did you get it? How many points do you got? Therefore, septic shock is the right answer. IV fluid, and then process, and then blood pressure, urine output. This is next generation NCLEX, both type question. That's the way you approach them, and I hope you get all the answers right. And next is providing teaching to a client with spinal cord injury. Yes, spinal cord injury. The next recommend high fluid intake for which of the following reason? What it means. If you have spinal cord injury, why do you need to drink a lot of water? Prevent autonomic dysreflexia, improve respiratory function, prevent urinary tract infection, promote adequate fluid and electrolyte imbalance. Classic fluid and electrolyte question, but it tests your knowledge on fundamentals of nursing. Therefore, fluid electrolyte situation by urinary problem in a patient with spinal cord injury. Why do you want to drink a lot of water? I can tell you, this is the right answer. Preventing infection. They may have bladder issue, urinary retention. In order to prevent infection, drink a lot of water to dilute the concentrated urine and get rid of it. A lot of people will pick autonomic dysreflexia. This is not the reason why you drink a lot of water. You see why, if you don't pay attention to the nurse recommended high fluid, why do the nurse want you to drink a lot of water? Not because they want you to get autonomic dysreflexia. If I want you to worry about it, I will tell you patient has neck injury or spine injury above T6. Then that's your clue. I know you're going to pick improved respiratory function, the same thing, T6 and above mostly, but we are told spinal cord injury. We don't know the level. It does not matter. Drinking a lot of water has nothing to do with your respiratory function. And neither is the adequate fluid and electrolyte imbalance. That's the most common one most people will pick, but don't pick it. Mostly it's UTI. And it's provide teaching to a client with chronic kidney disease, same thing, kidney issue. Which statement by the client indicate the need for further teaching? That means you have chronic kidney disease and you know certain things about it. And I want you to write them down. I will avoid potassium-rich food. I will stay on high-protein diet. I will count gelatin as liquid. I will restrict my fluid intake. I will avoid processed food. This is what you teach the patient. This is a form of risk reduction, kidney issue, and I need to teach for further teaching if I see it. Stop, pick your answer, keep track of your record, and put it in the comment section if you want. This is the way you go. Kidney problem, what are the things you need to teach them? A, the urine, the kidney cannot make enough urine, electrolyte goes up. What are you going to tell them to do? There's one thing you should tell them is to avoid what? Potassium-rich food. Does that need further teaching? No. I'll stay on high protein. No, their processing of protein diet is usually bad. So they need to be moderate and low level, but you still have to get some protein. I will count gelatin as liquid. This is what people forget. When they say fluid restriction. If you give them jello, right, gelatin, it's going to melt. Anything that melts into liquid is part of the fluid. Therefore, they should count. There's no need further teaching. I'll restrict my fluid intake. Yes, you can't drink too much. That's why you have to count gelatin. I will avoid processed food because it has potassium and sodium in it. Therefore, only one answer. If you overselect, you get 0. These are the teaching you provide to renal disease patient. And then this is ethics question, right? And a management of care. And then administer a double dose of Ondansetron to a client with a small bowel obstruction by mistake. The nurse immediately inform the client of the error and document it. Which ethical principle is the nurse demonstrating? Beneficence, non-efficiency, fidelity, and veracity. What do you think she's doing? What is the nurse doing? You pick your answer. Break down the question. Wrong medication, Ondansetron, double dose, right? But what did she do? Let the patient know exactly. Telling the patient the truth, no lying. That is veracity. Beneficent, you worry about doing good. This is not the situation. Non-efficiency, what is that? You don't want to cause harm to the patient. You already cause harm to the patient by giving them a double dose. That's not what he's saying. And fidelity is what? Keeping your promise. There's no promise here. She made a mistake. She went into the patient, right? Being truthful, veracity. And next has attended staff education program on diabetic nephropathy. Patient has diabetes and he has nephropathy. That means the kidney is in trouble. With prescription, the nurse will anticipate the healthcare provider will prescribe for the client showing signs of diabetic nephropathy. Read, this is pharmacology. Rewrite it. Patient has diabetic nephropathy. What can you give them to slow down the process since they have diabetes? Prednisone, quinaprine, spironolactone, naproxen. Pause, select a video, let me know. But I can tell you this. Quinaprine. You see something there? You may have not seen it before. It's okay. But look like what? Linezolid. It has the same prayer as at the end, right? Therefore, no matter what name they put in the beginning, this is Linezolid. That will slow down kidney dysfunction in diabetic patients. Prednisone is a steroid. It does not do that. Spironolactone will cause high potassium, right? Somebody who is having kidney issue, we're in trouble. Naproxen, they should avoid naproxen in a kidney problem. Therefore, this is your right answer. And this is assessing a school-age child. I've given you the age, 7-year-old. What do you expect? Think about it. 7-year-old. What would they care about? Are they for themselves egocentric? Are they worried about being separated? Do they do magical thinking and concentrate and concrete thinking? That means they know exactly what is going on, but it's all concrete. It's not abstract. What do you think? Egocentric, they care about themselves alone. These people, they pass that age. Separation anxiety, 9 months, that's already gone. Magical thinking, preschooler, A, playing toys and other thing. This patient, school age, they have concrete thinking. That's all they care about. A client, a nurse is caring for 4 clients on the psychiatry unit. Which client should the nurse see first? Prioritization, by mental health question. Pay attention. Pharmacology, flavor. A client receiving fluphenazine, what is the patient complaining about? Muscle spasm. Client taking escitalopram, patient has what? Clonus. Client is taking nortriptyline, patient reporting xerostomia. Client is taking fluoxetine, it reports what? Insomnia. How do you answer this question? Divide it into 2. Figure out whether each medication that they're taking, the side effect or the signs and symptoms they've told you, are they something bad or expected finding? That's all. Pick your answer. Pick your answer. But I can tell you, for fluphenazine, first generation antipsychotic, you have muscle spasm, this is acute dystonia. I don't know if it's the number 1 answer. Escitalopram is SSRI. Clonus, this is what? Serotonin syndrome. Now, triptyline, you have xerostomia, dry mouth. And fluoxetine, which is what? SSRI, you can't sleep. And no, serotonin syndrome has to be the right answer because that's the most dangerous among all, followed by muscle spasm, xerostomia, and insomnia. And then enter a client's room and find the client unresponsive, no moving, and no observed chest movement. Nothing is moving. There is no movement, nothing, and the patient is unresponsive. Which of the following actions should the nurse take? CPR, activate the emergency response system, check cardiac pulsation for less than 10 seconds, and provide rescue breath. What do you think? For any question. I can tell you, you got to assess for pulse. Walking, unresponsive, no chest movement. That means no breathing. See if they have pulse, activate the emergency response system, and take care of this patient. But we need to make sure we can check the pulse. If they have breathing, then we do rescue breath if they have pulse, right? So these are concepts you should pay attention to when you're answering these kind of CPR question. Follow the steps. Make sure you don't mix anything. 20 question. What is your answers so far? What is your score? Look at it and see. But calculate it and see where you are. Tighten yourself up. It's like taking a break. Like you do in the rare and plus 20 question, you should take a break and come back. Refresh. Boot yourself up and get a better score if you're not doing well. But pay attention with your strategy. 21. What do we have? And this is caring for several clients in the operative unit who require surgical consent. All of them require consent. Which of the following consent should the next question? Select or apply. Management of care, a little bit of mental health associated with it, but this is principles of management of care. Patient need consent. Who the nurse should question? 17-year-old active duty sergeant is signing his consent for appendectomy. 45-year-old client sign consent for hernia repair after receiving what? IV midazolam for sedation. 50-year-old client is signing consent for colonoscopy after the provider explained the procedure. And a 75-year-old client with moderate Alzheimer's disease consent signed by the durable power of attorney, the family who has a power of attorney. Which situation do you think is inappropriate and the nurse should question it? I can tell you, you cannot have sedation before you get anesthesia. Bad problem. Therefore, giving them midazolam, benzos, they altered. They can't make right decision. 17-year-old army sergeant is emancipated minor. Emancipated minor, they can, because they can go to war and die. Therefore, they can consent for themselves. If you sign consent C after it's been explained to you, that's good. Moderate Alzheimer's disease cannot make decision alone. That's why they have power of attorney. Appropriate. So B is the right answer. And this is teaching a parent about what? Expected development for 9-month-old. What do you think? Which statement by the parent indicate understanding? Expected finding 9-month-old. What do you expect? My baby should be able to say 2 to 3 words. My baby may develop stranger anxiety. My baby should walk independently. My baby should have full bowel control. Always give the baby time to recover. Pause the video and pick your answer. If I were you, this is the way I approach it. 9-month-old. Okay. Walk independently. You don't walk until you are like a year. Therefore, C is gone. Full bowel control. Even 3 or 4-year-old patient, they don't have it. Therefore, I'm left with A and B. 2 to 3 words. That's a lot of words. And then stranger anxiety. A 9-month-old saying 2 to 3 words. I'm picking stranger anxiety. That's when they start to separate from each other. And this is reviewing the assessment data of a client with central venous catheter. Yeah, central venous catheter. The client's central venous pressure is 6. Which of the following findings should the nurse suspect? Select or apply. Adequate circulating blood volume, long crackles, peripheral edema, distended neck vein, capillary refill greater than 3 seconds, hypotension, tachycardia. This question requires some critical thinking, some fundamentals, and fluid management. What should you expect? This is the same question they may ask you, but they may frame it differently. Same concept. Pick your answer. Let me know. It's a select or apply. You don't have to select everything. I know you pick your answer and go back. I don't have to pick everything. I should expect. I have a CVP of 6. Central venous pressure between 2 to 8 is normal. So this is a normal CVP. Therefore, what should I expect in the normal blood volume? If your blood volume is normal, you're not going to have what? You're going to have adequate circulating volume. Therefore, that's the right answer. Your lung is not going to have crackles. Right? Wrong answer. You cannot pick it. You're not going to have edema. You're not going to have distended neck vein. Capillary refill greater than 3 seconds. That means what? Hypotension. You're not going to be hypotensive and tachycardia. One answer. This is one of the hardest questions. Why? Critical thinking, just finding what CVP of 6 is and how to interpret it. It means normal. Therefore, I have to be normal. It looks hard, but it's not. It's just one concept. If you mix it, you can't answer the question. Only one answer. And this is caring for a school-age child who is diagnosed with what? ADHD. Which intervention are appropriate? Select or apply. Attention, active deficit issue. Therefore, when you're taking care of them, address each of them. Administer stimulant medication in the morning. Encourage high stimulating classroom environment. Monitor height and weight regularly. Provide short structured activity. Restrict physical activity to reduce hyperactivity. There's a concept here. Which one? ADHD. If I'm taking this test, ADHD, I say, oh, I'll give you a stimulant in the morning so that you don't become insomniac in the evening. If you're already ADHD, hyperactive, why would I give you a high stimulating classroom? Wrong answer. You take stimulant, you're going to have height and weight issue because you can't pay attention, something short, structured activity. That's what you do. If I restrict your physical activity, you're going to get bored and you become hyperactive. So I got to give you something you can release the pressure, the stress in you. And so go do whatever, blow into a balloon. So I cannot restrict you. So those are your right answer. This is assign a client with leukemia and disseminated open non-crusted herpes zoster lesion. Classic NCLEX infectious control question. Safety. You know it. But then you see these big words, you run away. No. Sit back. Say, I got this. Infectious control. Big. More than 11 to 15%. I'm picking it and making sure I get points. Which transmission-based precautions are appropriate? Airborne and contact. Airborne, contact, institute and hygiene by soap and water. What do you think? Pick your answer. Then you go back and when you pick your answer, you said, let me break down the question. I want infectious control transmission. I have leukemia, immunocompromised. And I have what? Zostis, right? But this is decimated, spread everywhere. Even though if it's not shingles, if it's localized treatment, but now it's gone everywhere. I'm immunocompromised. What is the problem? Shingles, zoster that are spread everywhere, immunocompromised. You treat it with like active varicella infection. Active varicella, look, because it's open and non-crusted, this will be airborne contact. That's the way when you see disseminated in immunocompromised, which is non-crusted, you treat it like varicella, which is airborne and contact. A charge nurse is evaluating discharge teaching provided to a client with macular degeneration. Which of the following statement by the novice nurse require intervention to reduce the risk of what? Client injury at home. Patient has macular degeneration. What do you tell them so that they don't get injured at home? This condition primarily affects your peripheral vision. You may have difficulty with the reading or recognized faces. You will need to avoid public transportation. You should stop driving immediately. Use a magnifying device to assist with reading. Use a very large print books and eye contrast material. Pause. Pay attention to macular degeneration, what kind of vision problem you have, and pick the right answer. Select or apply. Don't over-select. You pick yours? Now, let's get to it. The concept is what? This is your lens, and then your retina is at the back. When light comes, boom, you go to where the retina, right in the middle. In the middle, that's your macula. If it's degenerate, that means you can't see central vision. You can only see your peripheral vision. Therefore, this condition primarily affects my peripheral vision. It affects your central vision. You may have difficulty with reading and recognizing faces. Macula, that's the central area. That's the sharpness of the object. That's where you can recognize faces and read from it. So this, okay, does not require intervention. So this is good. This does not affect peripheral vision. Therefore, this requires intervention. You may need to avoid public transportation. That's a recommendation, right? It's a recommendation. And therefore, they don't need to avoid public transportation. That's what they need to do. Because they may not be able to drive, public transportation will be good for them. This requires intervention. You should stop driving immediately. No, they should not, because it depends on the severity of that. They may drive. There's some people who need the public transportation. Require intervention. Use a magnifying device to assist with reading because you need some sharpness. Does not require intervention. You can use large print books and high contrast material. This is saying the same thing. Therefore, does not require intervention. So go back again. This type of question can be very confusing because of the way it's written, right? They always say need intervention. Therefore, if you say this condition primarily affect my peripheral vision, no, central vision. I may have difficulty reading and recognizing faces. That's true. I will need to avoid public transportation. No, need further teaching. You should stop driving. No. Using magnifying device and large print does not require intervention. The next is evaluating several clients at community fair. Which of the following clients are highest risk for developing breast cancer? Health promotion question. What do you think? The 65-year-old who is experiencing menopause at 56. 20-year-old who had their first child at the age of 22 and breastfed. A 45-year-old with the first degree relative diagnosed with breast cancer. A 30-year-old client who began menstruation at 11 years old. Patient is 55-year-old. He has a long-term therapy on what? Hormone replacement. And a 40-year-old who has dense breast tissue mammogram. Who need what? Highest risk of breast cancer. If you know this health promotion, I want you to put your pen and paper, grab them, and then write this concept down. You pick your answer? Yes, number one person, 65, is older patient, experienced menopause at what? 56. Long exposure, long, late menopause. That means estrogen has been exposed for a long time. It's a problem. 28-year-old, first child at 22 and breastfed. Breastfeeding, pregnancy protect you. Therefore, this patient is good. 45-year-old client, first degree relative diagnosed with breast cancer, family history, first degree. 30-year-old who begin menstruation at the age of 11, early menarche and late menopause. What does that mean? When you have menses early, that's early menarche. That means you get exposed to estrogen for a long time. If you have late menopause, you also get exposed. So 1 and 4D are saying the same thing, just different age. Hormone replacement is a risk factor. And if your breast is dense, it's difficult to find things. So you're more likely to mix things and therefore more likely to have high risk for breast cancer. So these are concepts, and I want you to write them down. You can take a picture of this risk factor for breast cancer. Early menarche, that means you have menses before you're 12, and you don't go into menopause. This should be 55. You don't go to menopause, you go late 55. Neuropathy, family history, all these things are risk factors for breast cancer. And next is caring for a client with central venous catheter, CVP machine. Which intervention should the nurse implement to reduce the risk of infection? Infectious control, safety question. Perform hand hygiene before handling the line. Use sterile technique for dressing change. Strap the hub before assessing the line. Use clean gloves when changing dressing. What are the concepts you should apply when you're taking care of a patient with the central line? Pause the video, let me know. But I can tell you, hand hygiene is not a bad idea. This is a sterile technique. So you use sterile gloves. Change the dressing only when soiled. No, for the protocol. Scrub the hub before assessing it with alcohol to prevent infection. Use clean gloves. Use sterile gloves when changing dressing. And next is caring for a client on orthopedic unit who is 2 hours post right leg cast placement. Let's write it again. I place a cast. Which of the following interventions should the nurse include the plan of care? That means what do you do when somebody has a cast and you're taking care of them? Elevate the affected leg above the level of the hand for 72 hours. Apply ice directly over the affected leg. Cover the cast with a blanket for 24 hours to retain heat. Use fingers to handle the cast when turning. Encourage the client to wiggle the toe frequently. What do you think? Pick your answer. Stop the video. Analyze your concept. This is based on cast care. If you need care on cast care topic, especially musculoskeletal, check Adapting Class. I have a playlist that you watch all those videos free. What do you think? He said I should include elevate the leg, what? Above the level of the eye, 72 hours. No, too long, 48 hours. Apply ice directly over the affected leg. Don't put it on the affected leg directly. Cover the cast with the blanket for 24 hours to retain heat. You should expose it. Very, very important. Expose it so that it can dry. Use your fingers when handling the cast when turning. Remember, 2 hours after surgery. It's going to put indentation on the cast. It's not good. Encourage the client to wiggle their toe the toe frequently. This to prevent DVT and improve blood flow. One quick answer choice. Overselect, you lose all the points. And next is caring for multiple clients in the cardiac unit. Which client should the nurse see first? Prioritization. Client with pericarditis, he has a friction rub. Client with endocarditis, he has a pneumoma. Client with peripheral artery disease who has leg pain and rest. And a client with thoracic aortic aneurysm who has chronic pain and cough. Once again, you see these prioritization with a bunch of big words. The words does not matter. It's what is happening to that patient. What is now happening? Pick your answer. Let me know. I would like to know. Question 30. What was your score? Put it in the comment section. Once again, welcome to Adapting Class family. Question 30. You pick your answer? I can tell you. Peripheral artery disease, you're not supposed to have rest pain. You get pain when you move. Rest pain means ischemia, threatening limb. Pericarditis, you have friction rub normal. Endocarditis, expect you have a pneumoma, heart murmur. Just because I put new there, you should worry about. Remember, from Jane, the emboli, okay, go into the heart, and then you go into the valve and causes what? Endocarditis and pneumonia. Thoracic aortic aneurysm, bad problem. But chronic cough, it means it's just pushing on your esophagus, and that is expected finding. You are not having dissection. I did not say radiating towards the back with pain. C is the right answer. You just go by what they've given you, not what you expected to happen. And this is caring for another adult client who is at risk for fall. Which of the following interventions should the nurse charge nurse question? Nurse institution plan, patient has risk of fall. The charge nurse is going to question. That means it's a wrong implementation. You see the way I analyze it? That's the way you should read it so that your brain will catch up. If you just read the question the way it is, you can't, that's no normal way of brain thinking. So I interpreted it. Patient has a risk of fall. Now the nurse implement certain things the child needs to question. Bed in the lowest position, room is dimly light at night, 2 upper side rays are up, client wearing non-skilled footwear. What do you think? Right answer, I can tell you, it's the room light is dimly at night. You should make sure it's wide open so that the patient can see. The bed in the lowest position, good. 2 side rails are up, right? Not all the 4, right? This is the 2 upper, so the patient can, when they roll up and down, they don't fall down. And then they should wear non-skid footwear. This is a classic, you have to know. We are not raising all the 4 rails, always raise the 2 upper one, and that'll prevent the head from falling. And this is preparing to administer digoxin to an adult client. Which of the following actions are appropriate? Digoxin principle, safe medication administration. What are the things you need to know? Hold it if the apical force is less than 60. Patient was given antacids to reduce GI upset. Assess potassium level before administering. Notify provider if the client reports seeing halos, and administer even if the heart rate is irregular. Which condition is appropriate? Number 32. Digoxin, I can tell you, heart rate less than 60, I'm going to hold it. Give with antacid to reduce GI upset. You should not give it to antacid. Why? Because you get nausea. If I see nausea, it's what? Primary toxicity, early signs. Therefore, if I give you antacid, it's going to mask it. We should not give it to you. I want to make sure when you have nausea, I know about it. Assess your potassium level before giving. Yeah, that will cause toxicity. If you see halos, you have vision changes. That's a problem. If your heart rate is irregular, we just control the rate, not the rate themselves. So this is a rate control. Digoxin is a rate control. So if you have irregular rhythm and your rate is normal, like 80, 90, yeah, but you still have AFib, still we can give it to you. And this is caring for a client admitted with anorexia nervosa. Which of the following intervention in the plan of care should the nurse question? That means rewrite it. And anorexia nervosa, plan of care, that answer question, that means you should not put it there. Structured meal schedule with supervision, provide journal for reflective writing, get daily metabolic panel, and bupropion twice a day. Which one intervention should the nurse question that this is not appropriate? You pick your answer. Pharmacology, mental health, and anorexia nervosa, no bupropion will cause decreased appetite. They're not going to eat, and they get into trouble. They lose more weight. What is the problem? Metabolic panel. We need to check the electrolyte. We need to let them express their feeling and then structure them a meal plan so that we can see you when you eat. You don't vomit your food out. Which medication order should the next question? Pharmacology, parent, heart failure, you're on ibuprofen. Bipolar disorder, you're on olanzapine and metformin. Hyperthyroidism, you're on PTU, pulpitureuracil. Hyperkalemia, and they have you on what? Losartan. Depression, you're taking bupropion in an anorexic patient. Which one should you worry about? Heart failure, no ibuprofen. You have what? Urinary fluid retention, it worsens your condition. Bipolar patient, you can take metformin or olanzapine. It's a second generation antipsychotic, no problem. Hyperthyroidism, PTU, put the thyroid down. That's the treatment medication. And you have hyperkalemia, you should not take losartan. It increases your potassium. We just talked about it. Depression patient is taking bupropion, is anorexic with decreased appetite, is a bad problem. Therefore, I should question this. And next is caring for a client with history of seizures. Safety question. Which intervention should the nurse implement in the plan of care? Safety question. Safety, safety, safety. Big on the ankles, 10 to 15%. Why don't you get all the points? Select and apply. Pad the side rails. Pad suction, place suction equipment at bedside. Insert the tongue blade during seizure to prevent aspiration. Keep oxygen available and avoid and provide self-restraint at bedside. Which one? Safety, seizures. You should implement in the plan of care. I can tell you, pad all the side rails so that when you have seizures, you don't have injury. You should have suction at bedside too. After the seizure, you can suck them after. Don't put anything in their mouth. No tongue depressor during seizures. You should have oxygen available. You don't need to restrain them. So if you don't take a restraint, self-restraint in the room. The nurse is visiting a client at home who had macular degeneration. Same question we saw, different flavor. Which of the following instructions should the nurse reinforce for home safety? That means now you know they have what? Central vision problem. They can only see peripheral. They have to reach large brains. Same thing. If you take in the ankles, you see something like that. Remember, the stem of the question has changed, but the concept same. Select and apply. Increase lighting in the hallway and staircase. Is that okay? Remove loose rugs and cluster from working area. Use large print label and high contrast marking. Place frequent use item within each reach. Use light in the bedroom and bathroom. Use handrails and non-sleep mat. Which one should you include to reinforce that the patient does not have injury at home? What do you think? Of course, lightly in the airway is good. Remove rugs and clusters, they will fall. Large brains because they can't see well. Frequent use items, they don't get up and trip and fall. Night light in the bedroom, you can see when night light in the bedroom is very good. It gives you a better vision. And of course, handrails and non-sleep mat is good. These are our safety things you can do to prevent the patient from falling. NS is reviewing several client medication lists and clinical situation. Which drug combination should the next question? Select and apply. You have a medication and clinical situation. Which one is your question? If you take now Pinoxin and you eat pepperoni pizza, it's okay. You take lithium and you take furosemide. You take clozapine, we're monitoring your IBC. If you have approximum, you take alcohol. You have Sertraline, and then you have what? Taking St. John's wort. Which combination should concern you? Pick your answer. This is pharmacology combination and a risk reduction. Pinoxin, that's MOIs, avoid pepperoni. Lithium, we want something to prevent dehydration. This is going to lower your potassium too. It's going to cause what? Lithium, we want to prevent dehydration. Lithium, we're going to prevent dehydration. This is also going to, furosemide is also consists what? Hyponatremia. Those two conditions, dehydration, hyponatremia is not good. Clozapine, I'm monitoring your WBC, that's okay. Approximum, no alcohol. Both of them are downers. SSRI, no St. John's wort. You're going to have into trouble. Stevie-Johnson syndrome. The client with chronic kidney disease is prescribed antacid. Which type should the next question? That means kidney disease, you know the things complication they have. What medication they should not take? You see, I changed the question. Don't take this antacid. If you take it because of your kidney problem, you're going to get into trouble. Calcium carbonate, aluminum hydroxide, magnesium hydroxide, sodium bicarbonate. Pay attention. This is a keyword. If you have kidney problem, don't give them magnesium hydroxide because they cannot metabolize it. Very, very important. That's the right answer. And next is caring for a client who has what dysphagia following strokes, so problem swallowing. Which intervention should the nurse implement to reduce the client's risk of aspiration? This is safety and risk reduction. You have stroke problem, I need to feed you. Which one should I implement to prevent aspiration? Place the client in a semi-fowler position during meal. Encourage use of straw for fluid. Provide thin liquid for easy swallowing. Keep suction equipment available. Instruct the client to lift the chin up when swallowing. Which situation do you implement to prevent, or condition should you implement for this condition? Which of these plan implemented is appropriate? That's all. Place the client in the semi-fowler position during meal. No, they should be upright. Fowler position. Therefore, we're not going to take it. Encourage the use of straw for fluid. It's going to aspirate. Provide thin liquid for easy swallowing. B and C are saying the same thing. No thin liquid. Take one. Keep suction equipment available. A, not a bad idea, right? Instruct the client to lift the chin up when swallowing. No, they should not lift the chin up, right? They tuck it down. Therefore, there's only one answer choice. If you were select, you get it wrong. So clients should be in a high fowler during feeding. If you want to prevent aspiration, they should provide thick liquid. And then when they're swallowing, tuck their chin down. No straw. One answer choice. Over select, you get 0. Number 40. How are you doing so far? Just checking on you. If this is a rare NCLEX, you should be ready to take a break. Why don't you take a break now? Pause your video. Go back, ease yourself, drink something, blow in the sky, make a song, whatever will calm you down, and come back, and then do this again. And nurse is caring for a client with what? Cystic fibrosis. Which of the following interventions should be included in a plan of care? Select and apply. Encourage high-calorie and low-protein diet. Administer pancreatic enzyme supplement 30 minutes before meal. Restrict sodium intake, perform chest physiotherapy 30 minutes after meal, administer vitamin A and K as prescribed. Cystic fibrosis, what do you think they need? That's all. Pick your answer, let me know. But you know, cystic fibrosis patient, they need high calorie and what? High protein diet. One is wrong because of the low protein. Just because you see high calorie, you pick it. No. Pancrealipase should be given with meal, not 30 minutes before meal. Restrict sodium intake. They should have high intake of sodium because they have sodium chloride channel problem. Perform chest physiotherapy 30 minutes after meal. No. Chest physiotherapy 1 hour before meal. And give them vitamin A, D, vitamin A and K. Yes, because they need fat-soluble vitamin. And that is what? A, D, E, K. So we give them A and K. It's fine. That's appropriate as prescribed. And that's the only answer choice. You should over-select, you get 0. Like I said, this one is hard. It tests you where you belong, how far you've come. In all categories, we're going everywhere. I'm hitting you. Delegation. LPN, UAP are working together. Which task should be okay for UAP? Anything that does not require thinking. Evaluate care for a pediatric client. Oxygen administration. Bed bath for a 12-hour post-op client. Grooming the hair of a 36-year-old client. Serving a bedpan to a 7-year-old. Which one is appropriate for UAP? That's all. Evaluation, negative. Oxygen administration is a medication. They can do that. Bed bath, ADL, they can do that. Grooming, ADL, they can do that. Bedpan, they can do that. And then teaches a client prescribe what? Pancrealipase for chronic pancreatitis. It's the same thing as the cystic fibrosis. The content you use it to answer it. Which instruction are appropriate? Select and apply. Take with every meal and snack. Crush the capsules before taking it. Swallow capsule as a whole. Wipe mouth after administration. Take on an empty stomach. Which one is okay for pancrealipase? You should take it with every meal. You should not crush it. It's a capsule. We get into trouble. You swallow the capsule as a whole. And you wipe your mouth because of the debris that will be left. And take on an empty stomach. You eat with food. You take it with food. Therefore, pay attention to that. Enzyme must be taken with food. Swallowing protects enzyme's integrity. Wipe your mouth prevents skin irritation. And do not crush it. Must be taken with food. And this is caring for multiple pediatric client prioritization. Which client should the nurse prioritize to prevent complication? A 4-week-old infant with non-bilious projectile vomiting after eating each feeding. 2-month-old infant backing cough and mouth stridor. 2-year-old child with audible wheezing at rest who is now calm. A 2-year-old child with Coca-Cola urine and leg edema 3 weeks after strep infection. Who are you going to see? Who are you worried about? Whose situation is bad? What do you think? Divide into two, see which condition is bad, and pick it. I can tell you, 3 is a problem. Do you see the problem? 2-year-old, audible wheezing, asthma patient. Now he's resting, and now he's calm. That's bad. Silence chest is in trouble. 4-week, non-bilious projectile vomiting after feeding, pyloric stenosis, nothing wrong with it. 2-month-old backing cough, right? Stridor, you know what it is. Cough. Coca-Cola urine and a leg edema, post-strep infection. There's nothing, no edema, no headache, especially headache. There's nothing like that to worry about as a priority. It just has post-strep glomerulonephritis. I have crop and I have pyloric stenosis. But asthma patient who is having silence chest is my priority. And this is caring for a client receiving chemotherapy who was administered Ondansetron for nausea. Which of the following findings require immediate intervention? Headache, lips marking and repetitive tongue movement, episode of dizziness with irregular pulse, constipation. This critical thinking question. This critical thinking question. Don't mix it. Pay attention. Don't overselect. Don't rush to pick your answer. Pause it, relax, get your right answer. But I can tell you, C is the right answer. Why? Ondansetron is what? It causes QT prolongation. He also has what? Extrapyramidal side effect. That's why you have lips marking, repeated tongue movement. That's tardic dyskinesia. But autonomic dysfunction is more important than movement disorder. Movement, we can deal with it, but if you're feeling dizzy, irregular pulse, this is QT prolongation. Headache, constipation, associated with what? Extrapyramidal side effect. Therefore, this is your right answer. So heart rhythm kills faster than a movement disorder. That's the clue you can use. So I'm worried about the heart rather than a movement disorder. The nurse is monitoring 4 clients in a teleunit. Which client should the nurse assess first? Client with sinus tachycardia, 110 who is anxious, AFib with ventricular response of 90, Torsade pontes on their monitor, and a first-degree heart block. Don't get trapped. I can tell which answer choice you pick, but don't do it. Pick the right one. You pick your answer? I can tell you, Torsade pontes is bad. It's a warning sign for VTAC. Don't pick first-degree heart block. A lot of people will pick it. As first-degree heart block is common. A lot of people walk around with first-degree, asymptomatic. That's why I never give you any more information. If you have AFib, you rate control 90, that's okay. Tachycardia 110 and anxious, because you're anxious, your heart rate is up. Therefore, that's your right answer. And then is teaching a client with a new ileostomy. Which of the following should the nurse instruct the client to avoid? Empty the pouch regularly, drink adequate fluid, eat a balanced diet, or high fiber food. Which one should you avoid? What do you think? Which one? That means if you have ileostomy, you should not eat this, or you should not do this. I can tell you, high fiber food will cause obstruction, therefore they should avoid it. Eating balanced diet is good. Drinking adequate fluid is good. And emptying the pouch regularly is a good thing to do. Therefore, that's your right answer. This you should know and pay attention to it carefully, because these are very, very important questions they may ask you. And this is monitoring for clients who had 24-hour post of following Roux-en-Y gastric bypass. Which client require immediate intervention? A client who has what? Report abdominal pain 6 out of 10 and nausea. A client who remain upright 30 minutes after meal. A client who report mild shoulder pain. A client whose heart rate is 60 and a decreased breath sound at the lung base. And know which answer choice you will pick. But listen to the question carefully. Pay attention to the keywords and answer the questions asking you. Multiple client, 4 patients, they all have Roux-en-Y gastric bypass. Whose situation 24 hours you should worry about? I can tell you, patients remain upright after eating 30 minutes after eating, they get dumping syndrome. You should lay down. Expected finding of abdominal pain 6 out of 10, nausea is okay. You may have shoulder pain from the surgery due to the gas being escaped. Your heart rate is 60 and you have decreased breath sound. Your heart rate is 80, decreased breath sound at the lung basis, athleticis, after surgery, 24 hours, expected finding. This is what I know most people will pick. Don't pick it. I want you to pick this because you can't remain upright. You have to lay down. And next is caring for a client who is clinically blind. Patient is blind. Which of the following actions should the nurse implement to promote client safety? Select and apply. Keep the bed in the lowest position. Orient the client to the environment using clock face description. Rearrange the room layout to improve accessibility. Place the call light within reach. Speak to the client before touching them. Implementation. Patient is blind. What are the things should you do? What do you think? Pick your answer, let me know. Question 48. Now I can tell you the key concept: if you're blind, your hearing is now your eyes. Therefore, you activate that sensory. Because they're going to fall, bed in the lowest position is good. You should arrange them because they're blind where the food is, but use clock face. Rearrange the room to improve accessibility. Right? They get confused if you keep on rearranging them. This is a trap. Call light within reach because they're blind. And you got to speak to them so that you don't startle them. Speak to them before you touch them. This is good. Client received pudenda block during labor. What is pudenda block? What is expected? That's all. What is asking? Where should the pudenda be? Where is the pudenda nerve? Where would the block be? If you don't know, there's a clue. It's labor. So we got to go where the baby is coming from. Relief of abdominal pain. Well, labor pain usually in your pelvis. Analgesic of the perineum. Yeah, that's the perineum in the pelvis. Numbness of the leg. Relief of back pain. What do you think? It said, what do you expect? Of course, they're going to have numbness of the leg. They're going to have relief of some pain. But that's not the purpose. Perineum will be anesthetized. That's the most important. And question 50. A medical surgical unit nurse is floated to the pediatric unit. Which of the following assignments would be most appropriate for the charge nurse to give them? They're from med-surg, they go to peds. They don't know ped staff. Give them something they're comfortable, something that they're knowledgeable, not anything of the unit that is complex. 6-month-old, bronchiolitis, high flow nasal cannula requiring frequent suction. 4-year-old new onset seizure receiving IV anticonvulsant. 10-year-old fractured femur interaction requiring routine neurovascular check. A 2-year-old epiglottitis receiving high flow oxygen therapy. Who is complex? That's all. Who is specific to peds? And then you give it to them. I can tell you, fracture. You just routine neurovascular check. Every nurse should be able to do it. Epiglottitis require high flow oxygen. It's too complex. Onset of seizures require anticonvulsant for kids, a lot of complex. Bronchiolitis, another high flow. So simple one, neuro check is easy. The nurse can do it. 50 questions. How are you doing so far? And what is your score? I would like to know. Let's get to it. A nurse is caring for multiple pediatric clients on the medical unit. Which client should the nurse prioritize to prevent complication? 6-month-old bronchiolitis and nasal congestion who is feeding poorly. 2-year-old with asthma who has audible wheezing and respiratory alkalosis. A 5-year-old with pneumonia who has a fever of that and productive cough. A 2-year-old child who is drooling, sitting in tripod position and dysphonia, who need prioritization-wise to prevent complication. Pick your answer, follow the B sharp, and then you will see a bunch of words. If it's expected, you ignore it. What do you pick? Bronchiolitis, nasal congestion, expected finding, even though you're feeling poorly. Asthma patient, audible wheezing, respiratory alkalosis. If it's respiratory acidosis, that means they're getting tired. An asthma patient will breathe very fast. They have respiratory alkalosis, expected finding. If you have pneumonia, you're going to have fever and productive cough. Therefore, somebody is drooling, sitting in tripod position, and he has dysphonia. This is epiglottitis. Bad problem. And this is teaching a client how to properly administer prescription to eye drops at home. Which statement by the client indicate need for further teaching? They don't need to know how to give eye drops. I will tilt my head back and look up before putting the eye drop. I will pull down my lower lid and place the drop in the conjunctival sac. That means right in the middle, in the middle aspect of the eye, closer to the nose. I should avoid blinking and squeezing my eyes tightly right after the drops. I will apply the drop directly onto the eyeball so it absorbs faster. Which one need further teaching? They don't know how to give eye drops, safe medication administration. What do you think? The right answer is what? D. Not directly on the eye drops, on the eyeball. That's a problem. You should avoid blinking and squeezing tightly because that will affect other medication. Is a problem. I will pull down my lower lid, and put it in the conjunctival sac area. And then I will tilt my head back and look up so that the medication can stay. This is your right answer. Not on the eyeball. And let's care for several clients. Which clients report is concerning? My lips swell after morphine. My skin is itchy after morphine. My stool are hard after morphine. The room spin when I get up after the morphine. What do you think? The room spin. Which one is concerning? If your lips itch, you may have allergy. The rest is all expected finding. And this is teaching you graduate about component of what? Implied consent. Implied consent, that means you give it the consent, but you cannot give it. So we think you will give it to me when you are awake, or you usually healthy to do that, or you have bad injury and you cannot give consent. You can say implied consent means you will do it if you have the capacity to do that. Which of the following the nurse should include? This is an emergency, impractical to obtain consent. Client will consent if able. Treatment will protect the client, and the client is in the emergency room. What do you think? Pick your answer. Let me know. Select or apply. Don't overselect. This is an emergency. Yes, we got to do it. Impractical to consent, because you can't consent. We'll do that. You will consent when you are able to. This is going to protect you. Just because you are in emergency room doesn't mean that's an emergency. Therefore, we're not going to add it to criteria for implied consent. And this is caring for a client diagnosed with rubella, infectious control. Which transmission-based precautions are required during routine care? Know what is rubella. and find what is good. Non-sterile surgical mask, single-use disposable gown, goggles, face shield, hand hygiene by soap and water, well-fitted respiratory masks. What do you think? It's Uvula. What do you think? It's airborne. Airborne, what do you need? Just a respiratory mask. You don't need non-sterile surgical mask. You don't need single-use disposable gown. You don't need goggles. You don't need face shield. You don't need hand hygiene by soap and water. Only one answer. Don't get trapped. That's all you need when you're taking care of rubella for your anklets. Is disease specific.
And is provide care for assigned client, which will be classified as high risk for falling, 45-year-old with pneumonia, receiving IV antibiotic, 80-year-old admitted for chronic diarrhea, receiving IV antibiotic via central venous access and as a rectal tube, 55-year-old with what? Ankle sprain, ambulating with the cane, a 60-year with dementia admitted for urinary tract infection. Pause the video, look at the situation. There is risk factors associated with falling. You have to count number of risk factors for each patient. What do you think? I can tell you the one who's going to fall is what? B. Why? There's a risk factor associated with age. Older patient, he has what? Receiving IV therapy, Sertraline, one line, one drain, one connection to the patient, and another rectal tube. We have 3 risk factors. 45-year-old receiving IV antibiotic. Even if you think IV antibiotic is a risk factor, there's only one. 50-year-old with an ankle sprain, ambulating with cane. You're using assisted device, one risk factor. 60-year-old dementia with UTI will stay in bed. We have what? Admitted with dementia and age. So at least 2 factors. But this, you got to be even more than older patient. But this patient has too many lines, rectal tube, central line, and is old. Therefore, we worry about it. These are the risk factors: age, use of assisted device, lines and tubes, medication, and previous history of fall. Those are risk factors. And then provide care for a client who just returned to the ward after abdominal surgery. Which position is appropriate? High Fowler, semi-Fowler, Fowler position, and supine. Think about it. They had abdominal surgery. Do they have incision in the abdomen? How can we relieve the pain? How can we support their respiratory status? That's what this question is asking. Perioperative care. What do you think? Which position is much better? High Fowler is too high, 90 degrees. The patient will not be able to support themselves. It will cause more pain. Semi-Fowler is too low. We want it to be 45 to 60. Fowler position is much better. And that's where we can put this patient to support it. Supine is a bad idea to put this patient. And then prepare to admit a client from the emergency room with draining sacral decube that tests positive for what? MRSA. Which room assignment is appropriate? Cohort with the client diagnosed with impetigo. Cohort with the client diagnosed with vancomycin-resistant enterococcal. Cohort with the client diagnosed with MRSA. Cohort with the client diagnosed with what? Adenovirus. This is a patient who has MRSA. What do you think? Which room would you put the patient? That's all. When you're cohorting, what do you think? It should be what? The same organism, not the precaution. Therefore, for this patient, which room are we going to put them? A, they're going to be with the same patient with MRSA. Even though impetigo is a contact and MRSA is a contact, the different organism. Vancomycin-resistant enterococcal is also contact, but different organism. Adenovirus is contact and droplet. We put it in C. The chart nurse is assigning client for the shift. Which client should be assigned to the most experienced RN? Post-op client ready for discharge. Client with newly inserted chest tube and bubbling in the water chamber. Client requesting pain medication for chronic back pain. Client who need vitals 30 minutes after blood transfusion. For experienced RN, it should be somebody who is sick. Who should we assign to an experienced RN? I can tell you, Is the one who is sickest is B, because he has chest tube injected, there's bubbling in the water cell chamber, there may be air leak, they need monitoring. Post-op discharge, any RN should be able to take care of. Giving medication for chronic back pain, RN will be able to take care of, and need vitals is not that difficult. Experience should be given outpatient. Infectious control. Which of the following actions should the nurse take next? A nurse is caring for a client who has what? MRSA, infection. A rapid response is activated due to acute change in mental status. After the emergency, the team use equipment from the crash cart. Which of the following actions should the nurse take? Leave the card code in the client's room until discharge. Dispose all unused supply from the crash cart. Disinfect the equipment used before returning it to the crash cart. Dispose the code card. This is a clue. This is a strategy. Patient has MRSA infection. Patient was dying. They called the code. We went and fixed the patient. We bring the code card. We use equipment in it. You see the way I'm reading it? I'm not reading the question anymore because the question is so cumbersome, confusing. But I'm reading the way I understand it. So my brain is telling me this story. Patient has MRSA. He's dying. We went in to go take care of it. After we finished, what do we do with the code card? All the things that we have in the code machine. What do you think? Pick your answer. Let me know. But what you can do is disinfect the equipment used before returning it to the crash cart. You cannot throw them away. You can't dispose the code card. You don't open everything. Dispose all unused equipment from the crash cart. You can't do that. Leave the code card in the client's room until discharge. No, this is equipment that can be cleaned up and then can be used because it's a very special, important equipment. We can't leave it in the room. Next generation NCLEX. 70-year-old client present to the emergency department after falling at home. Patient has a fall. You got to figure out why. Client reports severe pain to the right hip and inability to move, probably as a fracture. Client pain described as sharp. The client has a history of what? Osteoporosis, probably. That's why when they fell, they broke their hip, simple fall. And then I went total hip replacement 6 months ago. So now hip replacement, when you fell, you break your leg. This is the temperature. These are the vitals. All of them are normal. Patient is anxious. His pain is 8 out of 10. His heart exams is normal. His lung exams is normal. His abdominal exam is normal. This is the way you tell yourself. Don't boil down to little things. The main thing is the buzzword I'm looking for. I look at the right hip. It's visibly deformed. Probably has dislocation from there because he just had surgery. He has shortened, externally rotated. That's what I'm telling you. You see, I'm taking the buzzword and I said, this doesn't sound right. If you broke your hip, I will see this. Even if you don't know, it means something has happened to the hip. That's all. Tenderness to palpation of the hip. Something has happened to the hip. The range of motion is decreased. All these things I can't bear with. It's broken, dislocated. I don't know. Patient has history of osteoporosis and hip replacement. So at least you fell, you broke your hip, you dislocated. I don't know. Let's see what kind of question they ask me. The nurse has reviewed the clinical data. Which finding from the case is concerning? Patient has 8 out of 10 pain. Is that worrisome? Concerning things, the things you want to fix right now. I want to fix it right now. Can you fix the patient pain right now? Unable to bear weight. Does he worry you? His hip is externally rotated and foreshortening. Those are all signs of fracture, right? Patient has history of osteoporosis. Can you fix it right now? Patient has previous history of what? Hip surgery. So which of these should worry you? Of course, I don't like his pain. And I don't like he can't bear weight. I don't like that his hip is rotated because it's a sign of fracture. For osteoporosis, I can change it. But the fact that he has a history of hip surgery, it tells me that, hey, maybe he dislocated his hips. Which of the following the nurse should what? Anticipate in the plan of care for this patient? Should we keep the patient in bed rest? Ask yourself. Should we get an X-ray for the hip? Do we prepare for close reduction? Probably it's dislocated. Do we give the patient morphine for pain, 2 milligram Q4? You do neurovascular check. What do you think we should do? Patient has a hip fracture or dislocation. Pick your answer. Let me know. Bed rest with the leg in the neutral position because we probably dislocated it. We need an X-ray to confirm it. We may need close reduction, may need some pain medication, and we got to do neurovascular check. All of them acceptable. X-ray confirm posterior hip dislocation. It wasn't fractured, but it dislocated. Close reduction was planned. That means we want to reduce it without making incision. That's what it means, close reduction. What is the priority nursing action while waiting close reduction? What would you do while you're waiting for close reduction? Give the patient IV fluid to prevent dehydration. Perform neurovascular check on the affected extremities. Place the client in the side laying position for comfort. Ambulate the client to reduce risk of DVT. What do you want to do at this point? What do you do? Which one should be your priorities? Of course, neurovascular check. Make sure there's no damage to any nerves or vessel. IV fluid, we are not worried about dehydration. Side laying is going to cause more pain because it's dislocated, and we're not going to work somebody who have dislocation. During neurovascular assessment, the nurse notes that the client foot is now cold to touch. There is faint dorsalis pedis paucis and posterior tibia. That means decreased vascular exams in terms of the blood vessel, and then there's a foot problem, right? This foot is cold, neurovascular issue. What is the nurse first action? What would you do? Let the doctor know, notify the surgeon, reassess the pulse, even though it's decreased and the foot is cold. Do you want to do that in 30 minutes? Document the finding and continue monitoring. Do you want to do that? Apply warm compression to improve circulation. You examine the patient. They have dislocation of the foot, hip, and now the foot is cold, and the neurovascular exams is decreased. What do you think? Of course, we should let the doctor know. We should not reassess them because these are signs of what? Compromised blood supply to the leg. They may develop compartment syndrome. Post-reduction, the nurse educate the client about preventing this future dislocation. So we reduce it. Now you want to teach them so that they don't cause another dislocation. This is the thing you teach patient after hip replacement. Things to prevent dislocation, how to burn, how to do certain things. So which statement indicate correct understanding? I should avoid burning my hip more than 90 degrees. Crossing my leg at the knee will help keep the hip stable. It is safe to sleep on the side without any pillow. Twisting my body while standing would harm my hip replacement. These are things you have to teach them. That's why probably they have hip dislocation. What do you think we should tell this patient? You should not bend more than 90 degrees. That's why you have a problem. You can use high toilet seats, all these things, and then crossing your leg, you should not cross your leg, right? You should safe sleeping on your side. It's not good. And twisting your body will cause more dislocation. What complications should the nurse monitor for after close reduction? After we reduce the hip dislocation, what should we worry about? Is it DVT, wound infection, hip joint instability, or fat embolism? What do you think is very important to monitor for? I can tell you, it's the stability of the hip, because when you reduce it, that's what you care about. It's not about DVT, no wound infection, or fat embolism. Fat embolism is associated with long bone fracture. DVT is not moving, therefore joint instability. This is a question that you may not be familiar with, but you know it. Just walk through it. Hip fracture, you think you're not going to get a case study like that. But that's what, you know the things. You bring all the concept in terms of neurovascular check, all the things that you worry about. So pay attention to this kind of question. A new graduate nurse just attended a workshop on infections control protocol. To show correct understanding of the teaching, the new graduate nurse will don what? I need to wear respiratory masks, gown, and glove to enter the client's room who has what? Scabies, adenovirus, disseminated, open shingles, and active TB. Rewrite the question. Think about the situation. What kind of PPE they're supposed to don, and which situation will require that kind of PPE. Pause, answer the question, and let me know what you answer. This is NCLEX practice question, NCLEX questions and answers, NCLEX review questions, 85 questions to master your NCLEX and to pass it. This is NCLEX practice test. What do you think? I need masks, respiratory masks, N95. Which of these will require N95? Scabies doesn't require that contact. Adenovirus is a droplet and contact. Therefore, A and B is gone. I have what? C and D. I require respiratory masks, both of them. Open shingles disseminated, you need airborne. But you need gown and gloves, that means you need contact too. Therefore, tuberculosis does not need contact, just respiratory mask. C is your right answer. Because open shingles require contact and contact and airborne, and that's the problem. And this is assigning tasks for the day. Prioritization, delegation question. Which task is appropriate to delegate to LPN? MMR most. Monitor, reinforce, teaching, stomach care, special tests. Performing the initial assessment of a newly admitted client. Administering a routine subcutaneous injection to a stable client. Developing the plan of care for a client with multiple comorbidity. Performing what? Discharging, teaching for a client with diabetes. Which of these is okay to assign to LPN? That's all. I can tell you, B is the right answer. Most medication they can do. For LPN, when they actually look for adjective, initial, they cannot do that. Developing, they don't do that. Discharge teaching require RN. All of this require RN. And it's caring for a client on bed rest, not moving. Which intervention best prevent pressure injury? That means we don't want injury there, pressure injury. Are you going to massage bony prominence daily? Do you reposition the client every 2 hours? Do you limit fluid intake? Do you apply heat pack to the pressure joints or points? What do you think? Turning, taking pressure off the area, always the best thing. Massaging bony prominence, you cause more injury. Fluid, you should increase fluid and don't apply heat, cause problem. And then is planning care for a client with what? End-stage renal disease who is receiving hemodialysis. Which of the following interventions should the nurse include in the plan of care? Select or apply. Encourage food high in potassium. Weigh the client daily at the same time. Provide frequent oral care. Encourage client to comply with fluid restriction. Encourage food high in protein. We saw a similar question, but different answers, different strategy. Pay attention. And Chris will do that. And therefore, when you see it, don't panic that you get it wrong. It means they're testing you more. Pause, select or apply, don't over-select, and pick your answer. And I know you're writing down the concept. What do you think? End-stage renal disease, including the plan of care. We got to avoid too much fluid. We got to avoid potassium, number one. Therefore, which one should you do? Encourage food high in potassium, wrong answer. Weigh the client daily so that you can know if they have fluid deficit. Very, very important. Oral care. Uremia can cause problem with the oral cavity, and therefore patient appetite will decrease. So uremia will do that. So you got to check their mouth. Encourage client to comply with fluid restriction. Yes. Food high in protein will not good for them. Too much protein, they cannot metabolize it. Very, very important. So end-stage renal disease should limit potassium and protein. They weigh them at the same time, fluid restriction, and then oral care due to uremia. Very, very important. Another next generation. This is a bow tie question. You should respect that. Give you case study. Just relax. Don't worry. Just work with what you have. Don't bring anything in. All the information is there. 30-year-old female. Gravidate 2, para 2 pregnancy, 2 babies. Present with what? Heavy vaginal bleeding. She's bleeding 2 hours after spontaneous vaginal delivery. After they have baby, they delivered the baby already. Now I'm bleeding. The delivery was uncomplicated. There was nothing wrong with it. The placenta was delivered intact. There was no retention of placenta. She reported feeling lightheaded and weak because she's bleeding. On examination, blood pressure is 90/50. Bleeding, postpartum hemorrhage, right? Heart rate is 120. Postpartum hemorrhage. She appeared pale and diaphoretic. Postpartum hemorrhage. Uterine palpation revealed was soaked and boggy uterus. The uterus is not coming down. Estimated blood loss delivery is 900. Postpartum hemorrhage, and we have all these features. You see how as I go, I broke down the question. What is the client experiencing? Uterine atony, retained placenta tissue, genital tract infection, and coagulation problem. What do you think? Is this the problem that is happening? What do you think? Look at it, all the information. Patient, uncomplicated, bleeding, lightheaded, weak. On examination, blood pressure is 90/50, heart rate is 120. She's pale and diaphoretic. The urine is what? Soft and bulky. What is the key thing? It can be what? Placenta retention, because then the uterus will be contracted. It's not going to be bulky. Genital laceration, you're going to see what? Hematoma in the pelvic. This is not coagulation problem. This is uterine atony. It just tells you, you can see bulky uterus bleeding. That's the problem. If that's the problem, then what would I do? I give them uterotonic medication, perform uterine massage, get a CT scan, prepare for surgery. Of course, we're going to give them something to contract the uterus, uterotonic, and then massage the uterus. And then what are we going to watch for? Bleeding, hemoglobin, and their vitals. Perineal wound, we're going to worry about genital traction. PTT, INR, we're going to worry about coagulopathy issue. These are very, very important. And as you can see, both are questions. If you figure out what is wrong with the patient, the rest is history. How did you do? I know you mastered it. Few questions left, less than 10, and we'll be done. We'll be done at 76 questions, but a total of 85. And then she's preparing to irrigate the year of a 50-year-old client. Which of the following actions should the nurse take? Remember, we saw a similar question. I intentionally said it. You have to place the steps in order. Now, which one should the nurse take? That means you have to know how to irrigate the year. That's all. The concept you use to arrange them, now there's no arrangement. If you see each question that is wrong, don't pick it. Which of the following action do you take? Know how to do that. Warm the irrigation solution to body temperature. Is that what you should do? Pull the auricle down and back. Direct the stream of fluid towards the tympanic membrane. Place an emesis basin under the affected ear. Instruct the client to tilt the head towards the unaffected side. Stop the procedure if the patient reports dizziness. These are concepts. You take the information that you use to answer the question on how to arrange the information. And now I'm just trying to test you if you really know it. This is fundamentals, medication administration, safety. What do you think? Pick your answer and let me know. But you need a warm irrigation solution, body temperature. Because it's an adult, you pull the ear up and back, not down and back. Therefore, this is wrong. Direct the stream of fluid towards the side of not the tympanic membrane, the ear canal, not the tympanic membrane directly. It causes problem. Of course, emesis basin under the what? Place an emesis basin under the affected ear. What do you think? Instruct the client to tilt the head towards what? The unaffected side. You're supposed to tilt your head towards the affected side. Stop the procedure if the client have what? Dizziness. That's what we're going to do. Stop the procedure if the client report dizziness. Instruct the client to tilt the head towards the unaffected side. That means away from it. If you put whatever fluid in it, it will go into the ear. You're supposed to turn your head towards the affected side. Place an emesis basin under the affected ear, so that you can collect it. Direct the stream of fluid towards the tympanic membrane. No, you should not do that. Pull the auricle down and back. That's what you do. A client states, I want to tell you a secret about something I did last night. What is the best response? The next best response. You can tell me anything. I won't tell anybody. I'm here to listen, but I must report any unsafe behavior. Don't tell me, it is not important. Tell me, and we'll keep it between us. Mental health, therapeutic communication. Which one is appropriate? B is appropriate because you can talk to me, but if you say something that is bad, unsafe, you're going to kill yourself, you're going to kill somebody, something homicidal, I got to report you. The rest of all, are not therapeutic. The client is receiving blood transfusion. The next team is made up of RN, UAP, LPN. Which task is appropriate for the UAP to perform? That means not anything that requires thinking, and anything RN and LPN will do, the UAP shouldn't do. Collect the blood from the lab. Check urine output color during transfusion. Check client vitals before the blood transfusion. Check the patency of venous access. Report hives or any signs of transfusion reaction. Stop the transfusion if the client becomes diaphoretic. What do you think the UAP will be able to do in this situation? That's all. They can collect the blood from the lab. Easy. Checking urine output color, that's assessment, the color. Urine output, they can record it by checking color assessment during transfusion. Check client vitals before transfusion, they can do that. Check the patency of the venous access that require assessment. Report hives and other signs of transfusion reaction. Just reporting. I'm not making an assessment. If I see hives, I tell the nurse. I cannot stop the transfusion if the patient becomes diaphoretic. That's RN job. A client with percutaneous endoscopic gastrostomy tube, that means gastrostomy tube, is receiving multiple medication. Which action by the nurse is correct? Mix all medication into a single syringe with 60 ml of water. Flush the tube with 15 ml of water before and after medication. Crush enteric-coated tablet and dissolve them completely. Hold all medication if residue is greater than 100. What do you think? Medication administration through a G tube. That's all. I can tell you, this is it. 15, not 30, not 60. Too much would dilute things. 15 before and after. You should not mix all medication. They may not be compatible. And coated, you cannot crush them. It causes problem. You should not hold on medication because residue is greater than 100. This is what most people will pick. That's a trap. Holding residue is based on how much, and even it's also based on symptoms. And it's in less than 250, you still give it to the patient and monitor their symptoms. And this is caring for a client who's enrolled in research study and has been placed on placebo. That means wrong medication. That means medication doesn't do anything. It may be water pill. The nurse tells the client that the placebo has the same effect as therapeutic. The nurse lied. He said, hey, this medication is doing the same thing as the medication we're giving to people who are sick. It's a placebo. Placebo is a water pill, chalk pill. Which ethical principle the nurse violate? Veracity, autonomy, fidelity, justice. What do you think she did? Not being truthful, veracity. There's no autonomy here. There's no fidelity, no keeping a promise or justice. This is veracity problem. Violated ethical principle, telling truth. And this is assessing the client 24 hours after last alcohol intake. That means the last time they take alcohol was 24 hours ago. Are they withdrawing? Ask yourself, which finding will indicate alcohol withdrawal? Lethargy, diaphoretic, bradycardia, hallucination, hypotension, and tremor. Substance abuse, there's a way you answer question. If you memorize symptoms, trust me, it will be difficult. You have to have conceptual analysis of the question and how to use it. Pick your answer, let me know. But the strategy is to do what? Ask yourself, what did I take? Alcohol. And then I'm in withdrawal. Alcohol is a downer. If I don't have it, my symptoms go up. Lethargy, your symptoms still go up. Therefore, that's not what you see. Diaphoresis, your symptoms goes up. This is good. Bradycardia, symptoms going down. Hallucination, my symptoms are going up. Right. Hypotension, my symptoms are going down. Tremor, my symptoms are going up. Therefore, what do you see? Think about it. Which finding should the nurse see? Which one would the nurse see? There's a strategy here. 24 hours is the key. You don't get hallucination, delirium tremor until 48 hours. But you can see diaphoresis and tremor. Therefore, the right answer is B and C. If you put D, is okay. But I want you to know alcohol is notorious. Time is always play a factor. The time they start having hallucination is usually after 24 hours, getting to 48 hours. Therefore, C is the wrong answer. And I want you to pay attention. These are later findings. They get seizures, hallucination later. 3 more questions. A mother asks how to properly give a 6-month-old iron supplement. Which statements show correct understanding? I should mix it with milk to help absorption. I should use a droplet to place it at the back of the mouth. I should give it on an empty stomach with orange juice. I should stop giving it to my baby when a baby stool turn dark. Which one is appropriate? Correct understanding. Iron supplement, it does not matter whether it's a kid or adult. The principle apply. I can tell you, empty stomach with orange juice is good. Milk, you should avoid it. You need vitamin C, right? Droplets should not be put on the back, on the side. If the stool turn dark, that's suspected finding. The emergency department nurse is assigned to triage. Which client should the nurse assign first? Triage question, triage nursing, prioritization. Clients with beefy red ulcer above the ankle and brown skin pigmentation. A client with intermittent leg pain that worsened with walking and ease with rest. A client with leg pain, edema, redness after stepping on a nail. A client with calf pain, swelling, warmth after 12-hour car ride. Who is in trouble? Which one is a prioritization? Be sharp. Whose problem is concerning? Don't worry about the big word over there. Just look at what is bad. You pick your answer. DVT. Calf pain, swelling, warmth after 12 hours car ride, that's DVT. You step on a nail, you may have tetanus, fine, infection. Intermittent leg pain, that worsened, but when you stop, you go away. Claudication, bah. Beefy red ulcer, browning pigmentation, venous ulcer. It sounds bad, but that's expected finding. And the last question, 76. Thank you for watching. Thank you for getting here. Thank you for supporting the channel. If this video helped you, the next video that is coming, I want you to click on it and test your knowledge again. 85 question, English practice question. What is your score? Be honest to yourself. If it's less than 65, keep on watching it. Write down the concept that you have a problem and come back again. Check all the 85. Master them. Trust me, if you watch all of them, when you go to the NCLEX, it's become like a breeze. What is the priority action? And then observe a tuft of hair at the base of the newborn spine, right? Tuft of hair. That means there's hair near the spine. It's not supposed to be there. Notify the air care provider for further management. Document the finding and recheck at the next assessment. Explain to the parent that this is a normal variation. Perform a detailed neurological exams immediately. What do you think? It may be Spina Bifida related complication. Therefore, more further study we need to do. We don't need to document the finding and recheck an assessment. The doctor needs to know this is not normal, and you don't need a detailed examination. At this point, 85 questions. Thank you for watching. Thank you for subscribing to Adapt NCLEX. Good luck in your exams. Best of luck.